This is the normal anatomical position. The person is standing upright. He's facing forwards with the head and eyes directed straight. Arms are hanging on the sides. The palms are facing forwards or supinated. The feet is slightly apart and parallel. And that's a right hand and the left hand of the person. The importance of anatomical position is it's a universal and consistent reference point. So there is a clarity of communication among the medical professionals regarding the structure, movements, irrespective of the patient's physical position. Now, this is also helpful when you do a X-ray, MRI, or any radiological imaging. Now, so what is above is called the superior, what is below is called the inferior. So this is, as I said, this is the right and the left sides. Now, you have to understand there are three planes. The first plane is the sagittal plane, where the human body is cut into equal right and left halves. You can make out this. This is a sagittal plane. The body is cut into right and left half, equal halves. Second is a coronal plane, where the body is cut into equal front and back, or anterior and posterior. So that is the coronal plane. And lastly, you have the transverse plane, where the body is cut into an equal upper or a superior and inferior half. Now, another thing you have to understand, this is the midline. So, as you go away from the midline, we call it as a lateral. As you move towards the midline, it's a medial. And one more thing to add on is, as you go away from the trunk, we call it distal. As you move towards the trunk, we would call it proximal. It is applicable for both your upper limb and lower limb. Away is distal, towards the trunk is proximal. Thank you.